Hi everyone. For those of you who don't know me, my name is Isaac Friedel, and today I'll be talking to everyone about West Nile fever. So what exactly is West Nile fever? West Nile fever is a disease caused by the West Nile virus. This is a mosquito-borne illness, and it is a positive single-stranded RNA virus. In terms of taxonomy, the species name is its common name, West Nile virus. Its genus is Flavivirus. Interestingly, this genus also contains other mosquito-borne illnesses like Zika virus and yellow fever virus. Its family is Flaviviridae. This family contains other genera like Pestivirus and Hepachivirus, which house species like hepatitis C virus, which I'm sure we've all heard of, and bovine viral diarrhea viruses. In terms of history, we know that the first case of West Nile fever occurred in the West Nile region of Uganda in 1937. Our first patient was a female who presented with fever. Doctors actually assumed that she had simply just contracted yellow fever due to widespread outbreaks in this region at the time. However, once they had isolated the virus after inoculating the patient's serum in mice, they were able to compare the physical characteristics of the virus with the physical characteristics of yellow fever, and they actually found them to be different. So this meant that they were looking at a virus that they had never seen before or they had never heard of. In terms of outbreaks since its discovery, there are two major ones that we really should talk about. The first are outbreaks that occurred in the 1950s in the Middle East, particularly in Israel and Egypt. What's interesting about these outbreaks is the majority of the patients were elderly and in nursing homes. They found that these patients experienced inflammation of the brain following diagnosis and treatment from West Nile fever. This is a very interesting case because it's going to affect how the virus is treated within elderly patients in the future. Another outbreak that we need to talk about is the outbreak that occurred in New York City in 1999. This is the first recording of West Nile fever ever coming to the United States. So before 1999, West Nile fever was not a disease that the US dealt with, but since then, it has reported about 2,000 cases each year, and in 2023 alone, 47 states reported cases. The incidence per 100,000 people within the United States varies. In the West, it is particularly higher, but on average, it is anywhere from 0.38 to 1.09. So as I had mentioned before, West Nile virus is transmitted via mosquito bites to humans. Humans are not able to pass the disease amongst each other, and the only way that one can become infected with West Nile virus is to be bitten by a mosquito that is infected. Birds are reservoir hosts. There are over 300 species of birds that have been detected to be reservoir hosts, but the most common birds that we see infected with West Nile virus are sparrows and crows, and this is probably just because of their popularity, especially within urban areas. Additionally, equine species can become infected, but they are again accidental hosts, and humans, along with these equine species, are what we would call a dead-end host because they're not able to pass the disease among each other. In terms of the mechanism that occurs in order for one to become infected, the first thing that happens is the mosquito bites the accidental host, and the virus is replicated in dendritic cells as it migrates through the layers of the skin, the epidermis and the dermis. From there, the dendritic cells migrate to the lymph nodes where the virus replicates and is released into the lymph and becomes attached to macrophages. These macrophages then migrate around the body to specific organs like the spleen, and that is how the virus continues to replicate and infiltrates all parts of the body. So when it comes to symptoms of West Nile fever, they're very common symptoms. The first one is obviously going to be fever, and it's going to be accompanied by other symptoms like headache, body aches, swollen lymph nodes, a rash. Some patients experience pain behind their eyes. Another common symptom is a sore throat or joint pain, and even nausea and vomiting. Symptoms will begin within the first 2 weeks of exposure, so the first 1 to 14 days, and they can actually last as long as 6 months. The symptoms that linger for months on end are going to be symptoms like headache or sore throat. West Nile virus is actually largely asymptomatic, and only about 20% of people who are infected are going to show any symptoms of having the virus. We've found that this affects younger patients more. So as I had mentioned earlier, there are other forms of disease like brain inflammation that could be caused by the West Nile virus. But when we're talking specifically about West Nile fever, we find that younger patients are typically the ones that show symptoms. The last thing that I'd add about West Nile fever in general is that it is the most common syndrome resulting from West Nile virus. So as I had just mentioned, there are other diseases that can occur as a result of being infected with West Nile virus. These diseases are typically neuroinvasive diseases, and there are three that I think we should talk about. The first is West Nile meningitis. This is going to be very similar to other forms of meningitis, causing abrupt and severe fever and severe headache. Sometimes this requires hospitalization. Now, this does not necessarily mean that a patient has meningitis, but the symptoms are very similar and some of the same treatments can be applied. The second neuroinvasive disease that I want to talk about is called West Nile encephalitis, and this is actually the inflammation of the brain that is caused by infection from the virus. This typically manifests within older patients who are 55 years or older, and it can also result in Parkinsonism or in tremors. Again, this disease is found in elderly patients, and it is the same disease that would have been found in the outbreaks in the 1950s in Egypt and Israel, when many nursing homes had become infected with the disease and many patients had experienced brain swelling. The last neuroinvasive disease that I think we should talk about is called West Nile poliomyelitis, and this is not to be confused with the infection from poliovirus, but again, this is just symptoms that are similar to that disease. So this is again going to be paralysis or weakness in one or more limbs, and it is all due to infection by West Nile virus. Symptoms are going to be a combination of poliomyelitis and West Nile fever. So fever is accompanied with the paralysis. The last thing that I'd like to mention is that there can be ocular effects that are as a result of the infection from West Nile virus, and it's going to particularly apply to cases of West Nile encephalitis when the brain has swelled and there is pressure being applied to the ocular nerves, so our vision might be affected. There are two major types of testing that are used in order to determine the presence of West Nile virus. The first is going to be the most popular, and that's going to be simple antibody testing. An example would be an ELISA test. These tests just indicate the presence of an antibody, and when that antibody is detected, patients are assumed to have either recently contracted the virus and are currently fighting infection, or they have contracted the virus in the past and the antibodies are still present within their body. We know that these antibodies are going to occur within the first 3 to 8 days of infection, so patients are actually able to find out if they're infected with the virus pretty early on. Another way that testing can be done is by taking images of the brain or the spinal cord. This is important because in cases where patients are experiencing West Nile encephalitis or West Nile poliomyelitis, we might see inflammation in certain parts of the spinal cord or the brain that would indicate that patients are in fact suffering from those diseases and the best way to treat them. Before we get into the specifics about treatment, I think it's important to note that most people who contract West Nile virus in their lifetime are then assumed to have lifelong immunity after they overcome the virus. Currently, there is no vaccine available to prevent infection from West Nile virus. And additionally, antibiotics cannot be used to fight infections because this is not a bacterial infection, it is a viral infection. So the best way to manage an infection from West Nile virus and the symptoms of West Nile fever is just going to be simple clinical management with over-the-counter pain medications like ibuprofen or Tylenol. And additionally, we want to make sure that patients are having high fluid intake levels to ensure that they remain hydrated throughout their recovery. Numerous clinical trials have occurred in hopes that a vaccine might be created, but there has been no substantial results to these trials. Hopefully, treatments to other similar diseases like yellow fever or Zika virus would help us to find a similar vaccine that would be able to treat West Nile virus, but currently there is no available. Additionally, patients with West Nile virus-induced polio or encephalitis, they should be monitored for their inability to protect their airway due to paralysis or congestion. Additionally, they might experience involuntary movements like seizures, so they should be monitored for those as well. Most patients with West Nile meningitis, encephalitis, and poliomyelitis should be treated for the subsequent conditions that they have contracted and not necessarily West Nile fever. So if somebody is experiencing paralysis due to polio caused by West Nile virus, they should be treated for the paralysis in ways that West Nile fever wouldn't necessarily be treated, because obviously there's a difference between treating somebody with an over-the-counter pain medication and then a medication that could potentially save them from paralysis. The last thing that I'd like to talk about today are preventative measures that we can take in order to ensure that we do not become infected with West Nile virus. There are actually 3 very simple things that are very effective that we can do. The first is to refrain from going outside at dusk hours when we know that mosquito exposure is high. So this is going to be in the summer when humidity is higher and mosquitoes are more likely to be out and about due to water sources. And the reason that we don't want to go outside during dusk is because the temperature of the air is lower due to the sun setting. So mosquitoes are going to be more comfortable coming out then and flying around. So if we can limit the amount of time that we spend outside at these times, then we can ensure that our interactions with mosquitoes are lessened. The next thing that we can do is use bug repellent, especially bug repellent with DEET that is going to deter mosquitoes from coming near you. These could be in the forms of off, a citronella candle, and sometimes even cities will have a truck that sprays bug repellent into the air at dusk periods to ensure that mosquito traffic is at a low. Additionally, a drastic thing that we can do, yet also a very effective thing, is we can avoid travel to tropical humid areas during specifically hot and humid months. So that's going to be months like August and September. If we can ensure that we don't go to areas that are tropical, that have high mosquito populations, then we can also limit the amount of times that we might come in contact with a mosquito that has West Nile virus, and we could potentially catch the virus from. Lastly, I'd like to summarize what we've talked about today. What we know is that West Nile virus and any subsequent diseases that it might cause, like West Nile fever, are mosquito-borne illnesses. Some common symptoms of West Nile fever are fever, rash, and headache, and neuroinvasive diseases can also develop from infections due to West Nile virus. These neuroinvasive diseases might have side effects similar to meningitis, poliomyelitis, or encephalitis. The best thing that we can do to prevent our exposure to West Nile virus is to use mosquito repellent. So by doing this, we can ensure that mosquitoes are deterred from ever coming near us, and therefore our risk of infection goes down drastically. Thank you for your attention today, and I look forward to your questions in class.